Hey everyone, my name is Eddie Joe. I'm an intensive care doctor and I happen to love evidence-based medicine. Why? Because it helps me take better care of my patients and I have such a passion for it that I review as much as I can. Go check out the rest of my YouTube channel as well as my Instagram account at EddieJoeMD and my website www.eddiejoemd.com so you can see kind of the things I do and how I want to promote critical care medicine and evidence-based medicine. I am not a researcher. I do not do any studies myself. I am in private practice, not in academia. So I always give the utmost respect and props to the authors of these journals. If you happen to learn absolutely anything from this talk, please hit the like button and subscribe if you want to learn some more stuff. I really appreciate if you all hit the like because that helps the YouTube algorithm. Trust me, I have no issues whatsoever sleeping at night. This is more to propagate basically everything I'm doing so that more people could benefit from it, and instead of me taking care of one patient at a time, this information could help treat hopefully millions of people. So without further ado, let's get started on this article that was published about 2 weeks ago in the Journal of Intensive Care Medicine, which is this journal right here. I apologize for not being able to share the entire article with you, but I don't want to get dinged by the copyright people because this was not a free article. I also want to give a huge shout out to these authors here because they're the ones who did the hard work of putting this study together. And I know it's going to seem as if I'm tearing this article apart, but in all honesty, they admitted to the flaws in their methodology and their study themselves. They were very aware of the limitations of their study, and I definitely respect that. Okay. Today, just as a point of reference, is the 31st of July of 2019. I reserve the right to change my opinion. This is my interpretation of this study. And I definitely welcome some interaction, banter, feedback down in the comment section below. It's already been 2.5 minutes. Let's get started with this bad boy. All right, so let me just go over here and go to this next slide where I erased all that other stuff so that it doesn't get in the way. Because I'm going to write things down on the screen and I want to make it as painless as possible. Please bear with me. Why is it important for us to analyze this whole thing of the stress dose steroids, vitamin C, and thiamine for septic shock patients? Well, to begin, the mortality in sepsis and septic shock could be up to 40% depending on the studies. The Process, Promise, and Arise trials all came up with numbers between 20 to 25%. The Many Rivers trial was about 40% back in the day. So we need to do better at this because we're struggling and our patients are dying. We need to come up with a better way. And then this whole thing about using the ascorbic acid, excuse me as I write here, sorry for the tapping noises, the thiamine and the steroids, these three things were a protocol come up with, am I saying that correctly? Anyway, Paul Merrick described this in a CHEST article about two years ago or so. And we're still waiting for some data. There are big time studies that are going on at the moment. This is not one of those big time studies, and I'm going to show you why. So their aim, as I go ahead and I highlight a couple things, was to go ahead and study the use of ascorbic acid, thiamine, and steroids in patients with septic shock. So what they did is that they went ahead and they looked at 62 patients. Here's one of the big issues with this study. So they had 62 patients. Hopefully you can read my handwriting. If not, you can just follow along. And they had 31 patients in each arm. You had the control arm, and you had what they describe as ATS. Sometimes you hear it seen or read it seen, or anyway, sometimes it's described as HAT, hydrocortisone, ascorbic acid, and thiamine. But basically, they had these two groups, and in the control arm, 15 of the 31 patients received the steroids part of this. That to me is a big limitation of the study because they're not really controls if they're getting part of the experimental part of the trial. So that's a big caveat to this. Now, with regards to the doses that they used, I did like this part because they received the ascorbic acid 1.5 grams every 6 hours for 4 days. So let me just write this down. The vitamin C, they used 1.5 grams IV. Some studies have used PO doses of vitamin C, and then they wonder why it didn't work. It's because it needs to be IV every 6 hours for 4 days. Okay, and then, excuse me as I clear my throat, the thiamine is 200 milligrams IV also even though there was a recent shortage, and I personally asked Paul Merrick what did he feel you should do during the IV thiamine shortage, and he was cool with just giving PO thiamine. But nevertheless, this one is Q 12 hours, also for 4 days. And then the steroids that was chosen and that were reflected in all these studies were basically hydrocortisone, and that is 50 milligrams, IV as well, Q 6 hours for 4 days. So those are the dosages of these medications that were provided. These were the same dosages that were provided in Paul Merrick's study that showed a significant increase in mortality, decrease in vasopressor use, yada, yada, yada. The objective of this particular video I'm making right now is not to go ahead and teach you guys all the little nuances of vitamin C and thiamine. Sorry if you came here expecting that, but this will make it a 45-minute video rather than a hopefully 10-minute video. Moving along, I'm going to skip everything that they looked at for the sake of time and just talk a little bit about what their findings were and what the interpretations were. But before I do that, let's talk about some of the other limitations of the study. The first one is that it's retrospective. You really want a good study to be prospective, so that, like that, you could randomize patients, you could do consecutive patients. The study did not have consecutive patients. So that's a dig on this study. The other one is single-centered. From my understanding, wow, that's really bad handwriting. From my understanding, this article was written by folks who were in a hospital in St. Louis. So hat tip to all you guys, hello over there in St. Louis. The other thing, quickly before I go into the findings, is that these patients were actually sick. So that's something that needs to be described in these studies to show efficacy with regards to mortality. And the reason why I say that is because 87% of the people were on mechanical ventilation and 82% of the people had positive blood cultures. So those are significant numbers, at least in my opinion, to signify the fact that the patients were sick. Okay, let's talk about the results and go through it in detail, The first positive P number with a P, well, the first statistically significant finding with a p-value of 0.001 was the fact that patients who received the ATS treatment had increased duration of pressors. And this was something that really caught my eye about this study. And the reason why it did so is because in theory, and what's been proved in animal models, is that vitamin C, or ascorbic acid, is a cofactor in the endogenous synthesis of catecholamines. So if you're going to be providing patients with this particular cofactor and their endogenous catecholamine production is not going to increase, that pretty much shows that it doesn't work. But the authors went ahead and described the reasons why they felt that this wasn't exactly as it was meant to be seen, but it's still rather confusing, okay? Because one job that the stressful steroids, vitamin C, thiamine combination is supposed to do, it didn't achieve it. So that's weird. The second thing that was important in this is that there was no more renal replacement therapy in the group that received the stressful steroids, vitamin C, and thiamine compared to the control. And the reason why that's important is because one of the big arguments I hear all the time from people who haven't gone through the data is the fact that vitamin C causes calcium oxalate crystals. To this day, and I'm willing to be proven wrong whenever I can, once again, that's why I say that today is July 31st, 2019, I have not seen any data that shows that there is more acute kidney injury using the vitamin C thiamine stressful steroids than to not use it in patients who are in septic shock. And this data with a p-value of 0.8 shows that. The next surprising finding is with regards to mechanical ventilation. In this case, both patient groups had the same amount of mechanical ventilation free days. They spent the same amount of time on the vent. Why is this a surprising finding to me? Well, I have heard through the grapevine of a study, and once again, this is me hearing things. You should not trust me. You should wait until this data actually comes out. There's some word coming out through the grapevine that there's a study of using vitamin C with acute lung injury and it decreasing significantly the days of mechanical ventilation. This study, with a p-value of 0.2, is not statistically significant for that, and therefore, sorry, did I get the right p-value? Sorry, nope, I did not. Let me go ahead and correct myself because I thought that that was way too low. So the p-value here was, as I skimmed through, greater than 0.9, which basically means that there was no difference whatsoever. This is, as I mentioned, important. So let me get rid of this one over here and let me clean this up. I hope that the tapping sound doesn't bother you guys. If you guys are cool with this format, let me know because I plan on using it more often. Now, next finding is ICU mortality. This one was very, very shocking to me for a couple reasons, okay? The first one being that the patients who got the steroid therapy, vitamin C, etc., they had a mortality of 9.6% versus the control group had a mortality of 42%. This is a big difference, so big that the p-value, what was it, is equal to 0.004. Tiny p-value. This really caught my eye because, number one, it seems like it's too much. I didn't expect this big a difference in ICU mortality. It just doesn't seem realistic to me. Once again, I could be wrong, but this 42% mortality is pretty high in a septic shock patient. You know, as I mentioned before, the numbers now seem to be closer to 20 to 30% or so. So 42 is a little bit high. And then this mortality rate of 9.6% in those patients who got the steroids in the experimental arm, this seems to be a little too good. But the part that makes me question the most whether these numbers are accurate or not, and once again, I use this in my practice, at least today I do. The reason why this catches my eye is because the in-hospital mortality was 29% in the experimental group, and in the control group, it was 45%. This number, though, is not statistically significant, okay? 0.2. Why does this catch my eye? I'm curious as to why these patients left the ICU so early but still ended up dying. And part of me wants to extrapolate, and I tried to find the what's it called, the appendix data, the supplementary data, to see if they would explain as to why this happened. If they had a really good intensive care team that was good speaking to families with cancer and other comorbidities about withdrawing care, terminal weans, things of that nature, better than most other institutions. And so therefore, the patients didn't die in the ICU, hence them having lower ICU mortality, but still having the same mortality overall. Does that make sense? So I'll try to explain it again in a different manner, but at the same time, I kind of want to finish this video because I've been rambling for a little bit too long now. Their ICU mortality is extremely low. Did they get transferred out of the ICU once the code status was changed, once conversations with families took place? Did that happen sufficiently to skew this information to where ICU mortality wasn't bad, but the in-hospital mortality was what it is? That's a question, and I look forward to possibly hearing from the authors. I don't know if I'm too small for them to reach out to me, but overall I thought this was a pretty cool study, and I wanted to share it with you all today. Once again, thanks for checking out my channel. Thanks for hearing me ramble for about 15 minutes with regards to stressful steroids, thiamine, and vitamin C.